Hey, look at that.
Oh,
Legit.
good.
Groovy.
Nice. So,
Cool.
viewers in already, so that's good. That's good that you get all set and get your face in the square.
Exactly. Exactly. Ugh. Can you hear me okay?
Yeah. How about me?
Okay.
Hear me fine?
Yeah.
Perfect.
Yeah. That's great.
Both got our
Aha.
on today.
Yeah, that's right. We're ready.
Right. All right, so let's start off with introducing ourselves. I am David Wilson. My pronouns are he, him, his, and I am a social media influencer at Whitman-Walker Health, and I've been in this role for about 7 months now. It's been really fun so far, and I'll let Amy, who's joining us, introduce herself.
Hi, David. Good to see you. Amy Nelson here, Director of Legal Services. I've been there for almost 12 years.
Nice. So another long timer. All right, so I know that some of the viewers have, joined other sessions. So over the last few months, Whitman Walker's community health department has expanded its outreach efforts, and with that, like we've really reached out to on our social media platforms to cover various topics about HIV, STI, health practices, access to care. Some things we might discuss today: social determinants of health and even general public health interventions. Our next series of outreach sessions have been focusing on COVID-19, our current pandemic, and the way we can manage, our sexual health as well as personal and mental health. So our community team, we've been here. We are here to educate and support our viewers. Thanks for joining in. So we are here for you. So how have you been during this time, Amy? How's your personal wellness going? How are you taking care of yourself being quarantined?
Yeah, that's a great question, David. I would say I'm eating a little too much, but more importantly, I'm trying to get some exercise. And also, I got a new dog. So me and the dog are outside in the sunshine as much as possible.
Yeah, similar to you, I got a new dog. I got a French bulldog who, the breed is supposed to be a calm breed, but he's not. So with him comes a lot of exercise, a lot of outside time. And I've also been cooking a lot. And I'm not generally a baker, but I've like learned how to make bread. I've learned how to make I really learned how to make I have a spin on so here's the thing. I've been trying to use ingredients I already have in my house. So I learned how to make a peach cobbler using pancake mix.
Ooh, nice.
It's been really good. So that's kind of like what I've been doing during quarantine. So, today, like our focus, here with Amy, who's from our legal services team, and then we'll also have Keefe, who's joining from public benefits and our insurance navigation team. We're discussing services available at Whitman Walker through, legal and public benefits navigation. So, Amy, why don't you tell us a little bit about, how folks can get in touch with public benefits, insurance, navigation, and legal services at this time?
Right. Well, I'm happy to say that legal services and the public benefits insurance navigators are all working hard, full time, around the clock. People need to reach out to us by phone and email rather than walking in. So the contact information for us should be on the screen pinned there. You can also go to the Whitman Walker website. But please know that we are here for you. We know that people are worried about their health insurance. They're worried about their jobs, their income, their access to benefits, and staying safe. Obviously, the folks we help, they're already frequently struggling. Dave, what happened to your face?
Yeah.
Oh, okay. So, like a lot of our clients, they're like they have a hard time. Oh, there's the dog. They have a hard time sometimes making ends meet in when things are not crazy, and now the world's crazy, and so we want to be even more engaged and more available and more responsive to help our legal clients however we can.
Absolutely. And you know, speaking of being more engaged and more responsible, I just want to thank you for being here today, you know, to help discuss these topics. So thanks, Amy. So, you know, what kind of questions, you know, what are the common questions that the legal services team are fielding right now? And, you know, how are you actually helping communities during this pandemic?
Yeah, so legal services handles a whole bunch of different issues, and we're still doing all that regular work, but we're also answering a lot of questions about folks needing either time off because they're sick from work or applying for unemployment insurance benefits because they've lost their job, or other sort of income security issues because they don't know how they're going to pay their bills. And so we can help people, you know, we can provide information about the stimulus check that's out there, paid sick time, and unemployment benefits. And then, you know, we're always here to help people access health insurance, uh, medical care, affordable prescription drugs, Social Security benefits, and in these times, we're also connecting a lot of people with food resources. And then just turning back to our basics, you know, we always help people with employment and workplace rights, discrimination in the workplace. So if somebody feels like they're being mistreated at work based on their sexual orientation, gender identity, or health status, they should absolutely call us. We're also doing estate planning. We're also helping folks with their name and gender changes, and also, lastly, you know, we have a robust immigration practice, and that remains active.
Great, great. Great. All sounds like great services to have during this time. And so really happy to hear that we still have all that in effect, and it's, you know, we're here to help. So do you have any advice for people who are working but maybe, you know, worried about having to take sick leave, maybe to take care of a, you know, family member that's sick or a child that has gotten sick? Any advice for those folks?
Right. So these days, a lot of people are staying home either because they're sick or someone in their family's sick, and there's really no choice but to be there to help take care of them. And the new federal laws, the CARE Act that was passed recently, provides paid sick leave for these sorts of things. And so if you work for a company that has 500 or fewer employees, then the CARE Act applies to you, which means you're eligible for up to 2 weeks of full-time paid sick leave. That's 80 hours, and then if you're part-time, it would be the equivalent of a 2-week shift for you. So if you're at home because you have a stay-at-home order, or your healthcare provider has told you to self-quarantine, you're experiencing symptoms, you're looking for a diagnosis, you're caring for someone in your family who's quarantined or sick, or you've lost childcare. These are all reasons how you can access benefits under this new sick leave bill. And then, of course, we always help people with Family Medical Leave Act protection. So that's the FMLA that allows people to keep their jobs if they're home looking after their loved ones. And so that's always out there as a benefit as well.
Yeah. So thanks for that information. I know that we're going to post in the comments the phone number to the Washington Lords Committee Workers' Rights Clinic. So please stay tuned in the comments to get that information. So we've been hearing a lot of talk about stimulus checks, and you know, I'm just curious, like, would a person like me be eligible for that money? What are the qualifications, and how much can a person actually receive?
Oh, that's great, David. Now, you and I will have to talk offline about your personal financial situation, but the check is available. The payment is $1,200, and that's for anyone who makes up to $75,000 a year. So let's say, and it goes up to $100,000. So if I make anywhere between $75,000 and $99,000, I'm going to get some amount of that $1,200. If I make below $75,000, I'm going to get the full $1,200 payment. And so the $75,000 applies to single folks. If you're married and you file your taxes together with your partner, then you'd be eligible for $2,400, and the income cap would be double, so it'd be $150,000. And there's also a $500 payment per dependent child. And so folks, you know, if they have a bunch of kids, they may end up getting the $1,200 plus another $500, $1,000, $1,500, depending on how many kids they have. Folks do not need to be a U.S. citizen to get this benefit, but they do need to have a valid Social Security number and be living in the U.S.
Got it. Got it. Good information. And I also want to make sure that people know that they can post questions or comments in the comment field. So if you have any questions while we're chatting along, feel free to drop that. So I see a question here. What if I didn't do my taxes yet? Can I still have access to those funds?
Yes, the answer is yes. If you filed your taxes in 2018 or 19, then you should be in the system. You should be fine. The If you got a refund either of those years and you did direct deposit with your bank, then the $1,200 might just show up magically in your bank account. You don't have to do anything. If, let's say, you didn't do direct deposit because maybe you didn't get a refund, maybe you owed money, then you will need to potentially contact the IRS so that they know how to get that money to you. And we'll talk more about that, but you can do that through the IRS website. And then for people who receive Social Security benefits, so that could be railroad retirement, Social Security retirement, supplemental security disability income, or rather SSDI or SSI. Those folks are going to get the payment automatically in their monthly benefit amount.
Mm-hmm.
But if they have kids, they do need to take the extra step of contacting the IRS.
Gotcha. And we're getting some good questions in the comments, so I want to address them. Tule asked what if you filed married but separate? What's your stimulus check status at that point?
Yeah, I saw that question. So I'm not a tax expert, but I believe if you filed separately, then you yourself would be eligible for only the $1,200, assuming you made below $75,000 for the year.
Gotcha. And so do people in TPS/DACA get stimulus checks? What about if you're if you are undocumented?
Yeah, so people who are undocumented or out of status, they are not going to be eligible for the payment. But again, depending on somebody's immigration status, if they have a valid Social Security number, and they're paying taxes, they will likely be eligible for that payment.
Got it. Okay. And so how do we make sure that, we get this money if we're eligible?
So like I said, you can go to the IRS website, so that's irs.gov, and we're going to post the link here, but it's pretty clear right there on the front page that there's a connection to get coronavirus tax relief, and then you can follow the links to the economic impact payment. I think we've been talking about it as the stimulus payment, but the official legal name for the $1,200 is the economic impact payment. And so follow the prompts for that on the website, and you may have to, go fill out a little form for non-filers where you provide, your name, address, email, social, date of birth, maybe your bank account information, your state license ID number if you have it, another PIN number if you have it. If you don't, you can leave those blank, and then, of course, information about your kids. So the good thing is that this is, it's a one-time payment, but it is available for folks to claim through the end of 2020. So if you don't get it right now, don't be panicked. You can still get it. In terms of when these checks are arriving, some people have already gotten these payments right into their bank accounts already, and other people, should be getting them soon in the bank account, or perhaps a hard check in the mail. The IRS is going to mail a confirmation letter to folks to their last known address within 15 days after a payment is made. So that'll help you know if maybe your check didn't get to you.
Got it. All right. And another good question. What if what if someone claimed me as a dependent? Do I still qualify for the stimulus payment?
Right, that's a great question. Yeah, so the answer is no. If somebody claimed you as a dependent, then you are not eligible for that money. And one other thing I want to mention for consumers is that there are a lot of debt collectors out there trying to get their hands on this money. And so, but under DC law, what's happened recently is that debt collectors are not allowed to contact you or try to collect money. And so if somebody calls you up and says, hey, I think you just got $1,200, don't forget you owe me half of that, or some other amount towards your rent, or some other bill that's out there, they can't force you to turn over that money. And so just don't forget that that money is yours to keep in your hands right now.
That is good to hear. So the stimulus check is yours to keep. Hashtag yours to keep. All right, so what if I, didn't file taxes for some reason or I wasn't required to? What is that extra step that you described?
Yeah, so that's just going to the irs.gov website, and you're going to fill out this box for non-filers. That's what I talked about with your name, address, social, date of birth, your bank account information, and that's what's going to connect you to that payment.
Gotcha. All right. So, when do we expect the stimulus payments to arrive?
So like I said, some people are getting them already, and some people will be getting them in the near term. So keep your eyes open on your bank account and in your mailbox.
Okay. So I see a legal question. This is very specific. Okay, what about wills and power of attorneys? I don't have family in the US, but I have property.
Yeah, so that is a fabulous question. So we do estate planning and advanced healthcare directive planning for folks. We have all those documents. We can help people fill them out and get them witnessed and notarized, whatever they need to do, depending on where they live. We encourage people to think about doing these documents when they're still healthy and still functioning. We certainly get calls from people who are in the hospital who are fading, and we have to rush and scurry to get those documents signed at their bedside, and we can certainly do that. It's a little bit harder these days because the hospitals are not letting visitors in to see people. But if you're healthy and well, and you're interested in these documents, you should call us. Definitely call us or email, and we can help you fill out those documents.
Wonderful. And is Whitman-Walker still helping, people with name changes and identity document updates for transgender and non-binary clients?
Yeah, absolutely. That's a big part of our legal practice. Unfortunately, we had to cancel our in-person monthly clinics for the months of March, April, May, but people can still call and email us, and we will help them fill out the documents so that they can be ready to file. Right now, most of the local courts are not processing these applications. There is a little bit of movement in Virginia, but for the most part, we can help people get their documents together so they can be ready to file once the courthouses open up again. So definitely people should reach out to us if they have any questions or concerns about their identity documents.
Nice. So that's good news. Um, so with the health crisis, I've been hearing that gender affirming surgeries are being postponed, unfortunately. Do you or are we still handling, insurance appeals?
Yes, we are, David. And so, yeah, a lot of people, we regularly help a lot of people with access to gender affirming care, whether it be, access to drugs or surgeries or some other service where the insurance company says, oh, we're not going to pay for this,
Yeah.
or the employer says, this isn't covered by your plan. We can help you file an appeal, and we want you to contact us because we want you to get this thing paid for and covered. We do not want you to pay out of pocket. We've been very successful with the appeals that we've filed, and so people should definitely reach out to us. One thing to remember about insurance denial notices is that they usually come with a pretty strict deadline to file an appeal, right, to follow up, to take the next step. And so if you get a denial notice, maybe you got one for something you were working on back in February, and you got the notice in March, don't wait to call us because we want to be sure that we don't miss any of the filing deadlines related to your appeal.
Wonderful. And viewers, if you have questions, continue to drop them. We've been getting some very good questions, so we want to make sure we continue to address those. So I have another question. With people getting very sick and maybe unable to advocate for themselves, what can someone do if they're worried about agency and making important healthcare decisions during a time like this?
Yeah, so that's something I was talking about before with the healthcare power of attorney documents and the estate planning work that we do. People should reach out to us, and we can help them get those documents in place. The best thing is to do that while you're healthy and well, when everyone's still around, so that you can be really clear about what your plans are and what you want to happen for yourself. If you're incapacitated or unconscious and you can't speak for yourself, the healthcare power of attorney document allows you or me to name an agent. So that's somebody we trust who can make those decisions on our behalf. And like I said earlier, we want to do that now rather than wait to the last minute, because sometimes, getting stuff signed when somebody's really sick can be a little bit harder.
Gotcha. All right. And what about people who may have lost their jobs? Do you have any tips around unemployment insurance at all?
Yes, so unemployment is a big deal these days. You probably heard on the news that millions and millions and millions of people nationwide are filing for unemployment. Here in the district, over 70,000 people have filed for unemployment benefits. And just so you know, that's more than double of all the benefits that were filed in last year, 2019. So that agency, the DC DOES, Department of Employment Services, they're working hard to keep up with these thousands of applications that are coming in. But we encourage people to be diligent about applying, because right now, unfortunately, the job centers are closed, and so applying in person is not an option. But people instead need to apply by phone, so they call into DOES or they go to the website. And unfortunately, right now, the website is not set up for phones. You got to have a laptop or a tablet to apply on their website. So unfortunately, the phone's not going to work. There is a group out there called First Shift Justice. I think we're going to post this in a bit. And they're taking phone calls. So if you don't have a computer and you're thinking, well, how am I ever going to do this? Maybe you've called on the phone a million times and you can't get through. You can call this other group and somebody will sit there with you on their computer and they'll put in an application for you. So one thing to remember about unemployment benefits is that they're not retroactive. Generally, usually, unemployment benefits are not. So it's important, if you lost your job, to apply right away, because you're not going to get benefits back before you applied. Now, one wrinkle to that is that one of the federal bills that passed created a new type of unemployment, and that unemployment will go retroactive. So that's called PUA, which stands for Pandemic Unemployment Assistance. And the good news is that that's designed to help people who are self-employed, independent contractors, gig workers, people who normally would not qualify for standard unemployment benefits. So under this PUA plan, they will qualify. Most states are in the process of trying to figure out how to add this benefit into their existing, systems. DC expects to start offering applications to this benefit tomorrow. We'll see. So you should go to the DOES.dc.gov website. We'll post more information about that. To apply for that PUA benefit if you're, like, say, you're an Uber driver or something. And then remember that unemployment is available for folks who have a drop in income or reduced hours or were temporarily laid off. So even if you have a job going back, or going forward July 1, you can still apply for benefits between now and then. We also encourage people to sign up for direct deposit when you file your first claim. It's just going to make life a whole lot easier. If you're enrolled in another benefit program that might be based on your income, you should contact our public benefits team, Keefe's team coming up, to tell them that your income has changed, because that may change how much you owe or don't owe for some of the other plans you might be enrolled in. And then a big thing I want to point out for our immigrant clients is that applying for, because there's the public charge rule that immigrants have been dealing with for years, and this administration made it much worse last year. So that says, if you're at a certain point in your immigration process, we, the government, are going to scrutinize your history. And if we say, oh, you were on food stamps, you were on Medicaid, you were on this benefit, that benefit, we might count it against you. We're going to look at a whole bunch of factors, but public benefits is that's one piece of that whole analysis. So we want to be sure people know that two big things about the public charge rule. It is not applicable to any care related to COVID, right? So if immigrants and their families and friends are worried, hey, I'm sick and I need to go to the hospital, I need to call an ambulance, but they've heard that accessing medical benefits could hurt them, there's an exception. Like nationwide, the U.S. government has said, no, we want everyone to seek care for COVID-related symptoms, and we will not, use that against you when we look at your public benefits or public charge history. So that's sort of the big takeaway there, is that no one should be shy about seeking medical care for COVID. And then the other thing is just that unemployment benefits are not public benefits in the sense that we, the workers, the immigrants, they have paid for those, right? Like they put in the hours at work, their employer paid into the system, they paid taxes, and so collecting unemployment insurance benefits is not even related to the public charge analysis. So we want to be sure people do that. And then the other thing is people need to have work authorization for the time that they're applying for. When they were working and now when they're not working, that's what's relevant to some of our immigrant clients. I think we're going to post some information here about, there's 3 organizations in DC that are doing some great work to help people with unemployment insurance appeals and answering questions too about the process. So you'll look for those coming up in the comments, I think. That those 3 organizations are going to be super busy, but they are here to help you. And so, keep your documents, keep your notes, keep your records. If you've been calling into the DOES phone lines for 2 weeks and you can't get in, keep your phone records, right? Because the attorney at one of these groups may say, well, look, I've got proof here that Amy's been calling you for 15 days and hasn't been able to get in. And so we don't want you to lose benefits for that time period that you might not have been able to get through on the phone system.
Got it. Wow, Amy, that's a wealth of information. So I just want to thank you for, updating us on these issues. I want to remind everybody that I pinned a comment at the bottom that has the phone number and email contact information for our legal services team, as well as the phone number for PBIN, which is our public benefits and insurance navigation team. So if you're looking for that information, it's pinned at the bottom. Thanks, Amy, again for joining.
Yeah.
Much appreciated. Lots of information. I know you're pretty busy during this time making sure people get these services. So really, thank you.
Yeah, absolutely. I'm happy to be here. Thanks, David. And like you said, I'm also thrilled to be working at Whitman-Walker. I'm always thrilled to be working at Whitman-Walker, but especially during this crisis, right, to know we can go the extra mile and help people connect to the services and care that they need. That's really an honor. And I know you're going to have a great conversation with Keefe, my colleague from Public Benefits, so I'll sign off and say so long and have fun with Keefe.
All right. Thank you, Amy. So we will have Keefe joining shortly. So I'll give Keefe a little time to jump in here. But thank you all for the great questions. If you have any more, just make sure that you post them in the comments section so that we can address them throughout Keefe's presentation. So looking forward to engaging with you all. All right. So while we wait for Keefe, I'll just chill out here. I'm so happy to be involved with Whitman-Walker during this time. There are so many resources that the organization has during this pandemic. We have the legal service, we have public benefits. We're doing our best to make sure people get their medications, even, with the pharmacy being limited. So, yeah, looks like Keefe just requested to join, so we'll make sure to accept. Hey,
Third time's a charm.
there you go. All right, so, how are you doing? How, is the quarantine going for you? Getting in the Instagram live room?
Yeah, this is my Insta live debut, so thanks for having me, David.
No problem. All right. So, again, thanks for joining. I'm going to reintroduce myself. So, I am David. I was going to say, this is David. I am David Wilson. I am a social media influencer with Whitman-Walker Health. I've been on the team for about 7 months now. My pronouns are he, him, his, and after you.
Yeah. So my name is Keefe. I go by my last name. So I am the manager of the public benefits and insurance navigation team at Whitman-Walker. Um, yeah, I use they, them pronouns, and I've been with Whitman-Walker, so not quite as long as Amy, but Whitman-Walker, keeps people around. It's a
Yeah,
great organization, so I'm so
great.
glad that you joined too.
Yeah, no, I've been having a great time. This is fun, like being able to engage with people on social media. I mean, what more can I ask for? So again, welcome. So I understand that the public benefits team is still supporting patients throughout, DC, Maryland, and Virginia, the DMV area. And so, can you tell us, like, right now, what are you like hearing from folks? What are their
Yeah,
major concerns right now?
yeah. So, yeah, I do want to mention, we are here, like Amy said, Monday through Friday, 8 to 6 o'clock. We are available right now through our insurance helpline. That's pinned below. Yeah, and so we're still helping people figure out what health insurance options they have. So we're helping folks enroll in Medicaid, Medicare, qualified health plans. That is, you know, through the ACA. So on DC Health Link in Maryland, we do Maryland Health Connection. Virginia uses the federal marketplace, so we can talk to folks about all of those things. In addition, we also talk to folks about COBRA or their job-based coverage and understanding what coverage they might already have. We're getting a lot of questions about, other benefits as well. So, food insecurity. So, any sort of SNAP, supplemental nutrition assistance program, the stimulus checks, the unemployment benefits that Amy went so diligently over. We can also talk to folks about, other things, other resources that might be available that they need. Um, and yeah,
Mm,
just letting people know we're here, and if we can get your questions answered for you, that's what we're here for.
absolutely. So yeah, and I think people underestimate, how important Cobra is when you are transitioning, out of a job. So it's glad to hear that public benefits it's here to help with that and help people navigate what their options are at that time. Because unfortunately, it is happening to people. People are losing work due to whatever economy we have right now.
Yeah, of course.
So I've also heard, there may be some changes coming to, health insurance because of COVID-19. Can you share any information that you might have about that?
Yeah, definitely. So I think, one big help is that those with Medicaid for their health insurance, if they were scheduled to renew their benefits, or maybe it was going to expire during when the crisis hit, up to now, they don't need to take any action. Their benefits are going to be extended without them needing to do anything. Um, for those who have lost health insurance or are uninsured or were already uninsured, um, we might have missed open enrollment or something like that. You're still might be eligible to get Medicaid, or to get a qualified health plan on the exchange. So we want to individually talk with everyone, figure out what their situation is, but also what their care needs are.
Okay.
And so we're still doing that. I think another big nice change, at least in DC, is they've been moving to online platforms for a lot of the application processes.
Hmm.
The service centers that would traditionally help folks in person are closed. Just like Whitman-Walker, we're cutting down our in-person interactions. So we are helping folks complete those applications over the phone. If you don't have access to a computer, we can help you do that. And I think we'll also pin the DC service center information for where you can go for that application.
So yeah, we've posted the sexual health hotline that we have here, but we actually got a really good question here. So
Sure.
to access the resources that you mentioned, do this person ask, do I need to be a patient of Whitman Walker to talk to an insurance navigator?
Absolutely not. So we are, Yeah, we're in community, so we are here to answer questions for all the DMV. There is no prerequisite to be a patient. We work with consumers from community. Traditionally, we mostly work with folks who are patients and who are in DC, but those patients connect their friends and other community to us. So we want to answer questions for anybody.
Great. That's good. That's a good service to offer. So thanks, Amy. So, what else are you hearing? Are there any other, issues people are bringing to the table? What's going on? Tell us. Give us a scoop.
Yeah, yeah. So I think if y'all were on here earlier with Amy, folks are really concerned around different income changes for themselves. So we're getting a lot of questions about unemployment income, what their income changes might mean for their coverage or for what they're eligible for. Concerns around affordability for things like their premiums or we just want to talk individually with folks and pass on any of the tips that Amy shared and help folks really understand what and how that impacts the eligibility for coverage. I think one big thing we're also addressing and have always helped with is medication access issues. So people, we're getting a lot of requests about people running low or running out of their medication while they're in quarantine and needing help navigating their insurance or getting insurance to help pay for it. So we're here still to help troubleshoot those things. You don't have to use our pharmacy to call us. We troubleshoot issues at the pharmacy for you,
Okay.
alongside you. Folks living with HIV, we also help with the AIDS Drug Assistance Program and all the jurisdictions in the DMV. So we even have some assistance around actually from the manufacturers of the medication. So those are called patient assistance programs. Will help folks to get into those programs and really just anything related to their coverage that they need help with.
Gotcha. And we have a good question in the comments. So the stimulus checks that, people are receiving, do they have to be reported as a change in income for SNAP?
The stimulus checks do not. However, the unemployment income, the standard whatever it is that you're given, does have to be reported. That's always been treated as earned income, but the stimulus checks do not.
And this was probably a good question because I just thought of this myself. So the stimulus payment, do you report that as income to unemployment? Did,
The
did you hear
stimulus
that?
check?
Yeah.
Uh,
Do
Sorry, I broke up a little bit.
yeah. No, I asked if, so the stimulus checks, do you report that as income to unemployment?
No, you don't need to.
Okay.
Unemployment would just be asking your, basically your income before COVID.
Got it. All right. So, is there any other, advice? We've shared a wealth of information on this session, with both you and Amy, but do you have any other advice or any tips you want to share that we might have not touched on?
Yeah, I think I just want to, reiterate that our mission at Whitman-Walker is to help break down barriers in accessing care, and crisis like this is just exacerbating that need.
Yeah.
So I just want to make sure that the community knows we're still here, and we want to treat everyone individually with what their needs are. We want to help them understand their health insurance options. We want to help them be able to afford it and reduce the cost as much as we can. Call us. Don't wait. I would say most of the agencies that we work with, they're managing remotely. They're managing short staff, taking care of their own family members or, childcare issues. So that just means, some of the applications and the programs are a little bit slower to respond. But we really want to make sure that you get what you need from start to finish. And we're just here to make this easier, help you apply, help you renew, and help you get them any sort of documentation that they need. Yeah.
Yeah, absolutely. So, thank you, Keith, again for joining us. I know you
Yeah,
were a little
me.
just getting in, but you made it. Um, it's always good to be able to share this information with our community because it is a troubling time and people have, trying issues that they have to overcome. So it's good to see that Whitman-Walker is here to help with that. So thanks for joining. Do you have any closing remarks you want to say before you before I
Oh
move
man.
to close?
Um, yeah, just stay safe, stay healthy. Call us. We want to talk to you.
All right.
Yeah.
Thanks. So I do want to remind everybody, that we have pinned at the bottom the information for our legal services team, as well as for Keith's team, the public benefits and insurance navigation team. So be sure to jot those numbers down and feel free to call or email us if you are looking for some assistance there. So I do want to say thanks to, legal services and, PBN for providing this information. I mean, it's been extremely insightful for me. I hope that you all have gained some value out of this conversation. But I also want to, direct you all to the Whitman-Walker website, and that website is whitman-walker.org. And you can check there for the most up-to-date information as well as resources, our other resources. So be sure to check out the website. And as always, follow us on Instagram, follow us on Twitter, and follow us on Facebook at Whitman Walker. And so we have another session, tomorrow. You can join us at Whitman Walker on Instagram. So that'll be at 6 p.m. So be sure to tune in. And I just want to remind everybody, and this is extremely important, stay safe, wash your hands, and make sure you keep practicing physical distance. And let's continue, to stay safe, stay home, but be alone together. So hashtag alone together. That's the end of our session. This has been a very, very good one. I mean, thanks, Keith. Thanks, Amy. Until next time.
Thanks, Erin.
Bye.